Hello, I'm Dr. Rhonda Johnson. It is Sunday, February 23rd, 2025. Today, I'm doing some health policy updates. While the Trump administration's 2025 budget plan proposes cutting Medicaid funding by approximately $800 billion over the next decade. So I want to put that into perspective. As of October 2024, almost 80 million Americans were enrolled in Medicaid and the Children's Health Insurance Program, also known as CHIP. Of those, almost 37 million are children, which means children represent nearly half of all Medicaid enrollees. Now, there are also almost 8 million seniors and 5 million persons with disabilities enrolled in Medicaid. So what does Medicaid cover, you may want to know? Well, Medicaid provides essential healthcare services, including hospital visits, doctor and preventive care visits, prenatal and newborn care, therapies such as speech, physical, and occupational therapy, prescription drugs, mental health services, and in some cases, transportation to appointments. Medicaid also covers long-term care for seniors, including home health and nursing home care. And for people with disabilities, Medicaid covers basic essential health services, the therapies, medical and adaptive equipment, and home and community-based care. So tell me, folks, how exactly will gutting Medicaid make America's children, seniors, pregnant persons, people with disabilities, how will that make them healthier? But there's more happening in healthcare. Since Robert F. Kennedy Jr. took over the Department of Health and Human Services, key public health decisions have raised concerns. For example, the United States has not shared flu surveillance data with the World Health Organization since January, potentially affecting the accuracy of next flu season's vaccines. The United States also has not confirmed whether we'll be in attendance at the World Health Organization's global flu vaccine meeting, despite playing a critical role in this meeting in past years. Now, what about all these layoffs? Recently, the layoffs at the Centers for Disease Control and Prevention, the National Institutes of Health, and the Food and Drug Administration have impacted disease outbreaks investigators, researchers, scientists, program managers, and professionals who work in the areas of food safety, medical device safety, and tobacco products. Health and Human Services, in addition, has indefinitely postponed the CDC's Advisory Committee on Immunization Practices. That meeting was scheduled for this week. This is for the first time in recent history. And this is the committee of experts that advises the CDC on vaccines, this very committee that RFK Jr. has criticized in the past. So, folks, the net result of this, less funding, less research, fewer experts, less healthcare services, and potentially more risks. I say this is not just health policy or politics. It's putting people's health at stake. And when you put their health at stake, you put their lives at stake too. So what can we do about it? Well, some suggestions are to contact your elected representatives, speak up, advocate, share this message. And you may have some other thoughts. Feel free to list them. And thank you for listening. I know this message was a little long. Take care and be well.